Thank you for joining us today at IFFGD's 2021 Virtual Advocacy event. Today we are focusing on how to find Facebook support groups, and with us is Nina Pan from IBS Support. Thank you for being with us today, Ms. Pan. Can you share a little bit about yourself and your group?
I am an educator, an advocate, and a person with IBS. I am one of the 14 admins of the IBS International Science-Based Support Group. IBS Support was founded approximately 14 years ago by a young man in the UK with IBS. He specifically wanted to create a science-based support group because historically the vast majority of online IBS support groups have been full of misinformation and quack cures and so on. He realized that it was very difficult for the average person with IBS or concerned family member to sort through what was reputable and statistically likely to be effective and what was not. It began as a very small support group, but with the collaborative efforts of many past and present admins, it has grown tremendously. We currently have 75,000 members and growing all over the world. We have about 1,200 or more posts per month, and we have 14 admins from 6 countries. Okay, 13 of us are adults with IBS ourselves, and 1 is the parent of a teenager with IBS. Several admins also have relevant professional backgrounds. Lee, our founder, is now a medical student. We have a registered nurse. We have several FODMAP trained dietitians. We have research scientists in other fields other than IBS. Although they understand the research process, which is very helpful. We have several educators, health, disability, and IBS advocates. One of our admins who runs a separate FODMAP site also has restaurant background. Those of us who do not have formal scientific credentials have spent years learning from reputable professional resources in the gut-brain disorder community and from our fellow admins. I do want to emphasize that nobody is acting in a health professional capacity or trying to replace anyone's own physician, but we do have collectively the background to run a science-based support group.
That is wonderful, and that is so great that you have such a wide range of administrators on your team with varying backgrounds and varying strengths to really create an all-encompassing group for the IBS patients that you support.
Yes, we work very hard and we tend to work very well together.
That is always great to hear, and it sounds like you all work so wonderfully together with 75,000 members. That is a remarkable reach and impact for the IBS patient community.
It's a challenge, but we do the best we can, and we think we do pretty well.
That is great. Can you tell me, now that you told us about how the group began and the administrators of your organization, can you tell me how you became involved with IBS support?
I became involved approximately 6 years ago. Several years before that, I had established with a few other adults with IBS a grassroots awareness and advocacy site, ibsimpact.com. As a result, I follow many sources in the IBS community, and I was going into IBS support and other groups to share periodically articles or events or resources, and I was noticed. The admin team tends to observe members who seem to know what they're doing as far as and talking about as far as IBS and the science are concerned, and seem to have the temperament to possibly be good admins in the future, should we need them. And one of the existing admins at the time was acquainted with me, and so apparently vouched for me, and Lee, the founder, approached me and asked me to join. I told him I would think about it, and about 3 weeks later, he came back and said, well, have you thought about it? And so that was that.
That's a great way to get involved, that they really pay attention to the community and try to draw in wonderful, well-educated and well-established members to become administrators for this group. It shows just all the thought and the care that they put in to IBS support. What is the focus of IBS support?
Like other support groups, one role is to maintain a place where people with IBS and family and friends who support us can gather and exchange information, vent, support each other, and among peers who understand what's going on. We do understand that very often people who do not have IBS in our lives do not understand, even though they try. It is a closed private group, so only members can see posts, not their entire Facebook feeds. However, since it is 75,000 people, it is, of course, advisable to take care sometimes in what one is posting. What makes us different is that we are science-based, okay? We very intentionally science-based and educational. The admins are very active on the board at all times. Since we're in different time zones, we pretty much have coverage around the clock, although we are all volunteers and we all have lives. So that can vary during busy periods. We have many files of information on or frequently asked questions on the diagnosis of IBS, treatment of IBS, research, the FODMAP, gut-directed hypnotherapy, medications, cognitive behavioral therapy, all of the effective treatments that are currently available. And we are there to answer questions, to correct misinformation, to offer high quality links, to redirect people to their physicians if we feel that it's something that the group is not equipped to handle. And also, having been through the ringer ourselves very often as people with IBS or family members of IBS for many years, what we are trying to do is help cut through some of that and direct people to accurate information they can take to their doctors, and also give them the information to empower themselves and to give hope. We want to show them that although there's no quick fix cure, unfortunately, at this time, and IBS can be very difficult, Um, there is a way to go forward, okay, as best we can. We have all been through it. Had IBS for many years, or have had a child with IBS for many years, um, which is now or at one time might have been very, very severe in many cases. But as I've said, we do have lives. Most of us are employed or were employed before retiring, or are completing education. We have homes, we have families, we have friends. Before the pandemic, we went out, we did things, we had social lives, we had traveled, and so on. And after the pandemic, we hope to do so again. Is it always easy? No, but it is possible. And we just do the best that we can. Uh, IBS takes a lot of patience and a lot of stability that we don't necessarily always know that we have, but it's the hand that we're dealt. And so we would like to give people that vision of what can be.
That is such an important service that you offer, providing patients with science-based opportunity to talk with other people, and that they know the information in your group is double-checked by your continuous work from the IBS support team to make sure that they are getting the right information, and that you stress the importance of that relationship with their healthcare provider and
Yes,
going
we
there if
try very hard.
necessary. Yeah, and taking that information to their healthcare provider. That is so important and certainly unique. And some support groups are not so well monitored. Are there any specific rules that community members must follow to be a part of IBS support?
Yes, we have many rules, which are not all visible before joining because of limited space on Facebook, but are available to all members once they join. And we certainly encourage people to read them when they join, and we frequently post reminders if we see that a particular issue is being a problem lately. I won't go through all of them, but I will say that they kind of fall into 5 different categories.
Okay.
Number one, we are science-based strictly. If people are interested in alternative medicine, that is certainly their right, but there are certainly many other groups for that, and ours is not one of them. Number 2, we are IBS, focused on IBS only. Okay, we do realize that many people have other conditions. Many of the admins have other conditions as well, but we want to stay focused. It is a very large group. IBS is a very complex subject. And people's understanding of it varies tremendously. And so we do not want to confuse members with other conditions or have people led in unsafe directions that admins might not have the knowledge to correct appropriately. In those cases, we will direct them to their doctors or support groups for a particular condition or life circumstance that they might be going through. Number 3, safety, that, which is things, do not try to diagnose people, do not ask for diagnoses, do not ask people to adjust your dosages, do not ask people to send you medication that might be available in another country and not in yours. We discourage private messaging, unlike a lot of other support groups, because we would like everybody who is reading, whether they choose to participate actively in the discussion or not, to benefit from the information that is posted. And we also want to discourage scammers and supplement vendors and so on, and harassers and so on. and other safety issues. Number four, we try to be welcoming and accessible to people of all demographic groups all over the world, and family friendly for all ages. We do have some young teenagers in the group, and people from all walks of life. So we try to make the group as welcoming as possible to as many people as possible. And number four is just various rules that make it easier for a group of admins, volunteer admins, given the constraints of Facebook, to administer efficiently. So they all fall within those parameters.
They all definitely seem like very important rules to follow for the size of your group and ensuring the consideration of all the members of your group and all the information you want to get across. That definitely
Yes.
seems very, very important and very vital to the success of your unique group.
Yes, people should know that although sometimes people complain about the rules, they are very carefully considered. They are collaboratively developed by all and agreed to by all admins. We try for consistency, and they are generally developed in response to issues that we see come up. So we're not just pulling rules out of thin air for the sake of having rules. But we really are trying to maintain an orderly, focused, science-based, helpful support group for those who are open to our particular kind of support group.
Well, that is great. And one thing that you touched on when you were talking about the community roles was other support groups. And of course, as you said, if it's information that doesn't fall under your category or goes beyond what your intention and focus is of IBS support, you will possibly recommend other groups. Are there any specific groups that you suggest, or is it general, dependent on person to person and their need?
It depends to a certain extent on the person's needs. As far as other IBS support groups are concerned, as I've said, very few of them are science-based. So it's hard to recommend some of them, but some of our other admins are involved in a support group specifically for those following low FODMAP, which is also an international science-based low FODMAP recipe and support group. IBS support doesn't tend to get into recipes because we just have so many other general questions to deal with, and the resources there. Our admins from Australia, admins an evidence-based FODMAP group, low FODMAP Australia. So we would recommend those as well.
Okay, so that is some great recommendations. Like you said, the low FODMAP, and of course, it's great for patients to know who are watching this that if they're a part of your group and want resources beyond, they can reach out to you to find those other groups you may suggest if they do not fall within your focus at IBS support. It's great that it's a community of networking to really support, as the name says, IBS patients and other needs.
Yes.
Well, thank you so much for taking your time to share with us about your group, Ms. Pan. And for those who just are joining us, we just chatted with Nina Pan from IBS Support. And if you missed Ms. Pan's talk, you can find hers and others from this event on IFFGD's webpage.
Thank you very much for the opportunity on behalf of all the admins of IBS Support.